a tilted pelvis. Too many people tie themselves in knots trying to do pelvic tilting exercises only to make their back pain worse. In today's video, we're going to tell you exactly what you need to know before you do another pelvic tilting exercise, so you know if it's right for you or if it should be avoided. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape. And today we're going to tell you the only way you can really know if your pelvis is tilted, in which direction, and by how much. And at the end of the video, we've got 3 tips that you can use to start to immediately deal with that pelvis and lower back so that you can rid yourself of that back pain for good. There's no better place to start than peeling back this curtain of pelvic tilt. And that is that when you lie on your back, that there is too much curve or there is a hollow. As you're lying down on the floor, people get quite fixated on the fact that there is a little hollow between the lower back and the floor. And this is completely normal. As we stand up like so, there should be a backward bending curve going into the gluteal muscles in the buttocks region. And that is a perfectly normal position to be in. We certainly should not have our back completely flat on the floor. It's natural, it's normal, and it should be there in all of us. When it comes to pelvic tilt, there are 2 simple truths. Number 1 is that you should have a smooth curve through the lower back, and the appropriate pelvic position has a degree of tilt to it because it is a direct reflection of the angle of your sacral base. That's the sacrum, the start of the tailbone, should have a slope approximately 40 degrees compared to the horizontal. So your lower back actually sits on a tilted pelvis, a normally tilted pelvis. And therefore that also does the second thing, which is it aligns your center of mass of your lumbar spine above the hip joints. If we are doing posterior pelvic tilts, like you're taught to all the time, as you tuck the pelvis round, you can very clearly see that the hips are now forward of the lower back. This is not efficient for weight transference. You need to have a normal, natural, neutral pelvic tilt, and this can be measured. So by fixing pelvic tilt with these pelvic tucking exercises, you're actually throwing things out of balance even more. You're putting more strain on the muscles, more strain and disadvantage through the joints, and less efficient weight bearing, which ultimately is not going to help your lower back pain at all. To close this section off, your last lumbar disc, this L5S1 here, should actually be a slight wedge shape, so kind of like a triangle. Not completely, but it's got a bit of wedge to it. It's not completely flat, like a rectangle. And so as we flatten down, we're actually compressing this disc even more and violating the natural principles that this should have with good alignment. Before we get into the only real way you can actually measure your pelvic tilt to know for certain, I wanted to cover some of the illusions that so many times you'll be told, oh, well, I have that. I should probably do some pelvic tilting exercises. And the first one of these is the abs sticking out. And that's that your hip flexors are tight, and they may well be, by the way, but that your tummy's sticking out here, so you must have pelvic tilt. And you'll give an exercise to strengthen up the lower part. And that's fine. Strengthening up the lower part is correct. But often it's just that you have no lower abdominal tone, which is why your tummy sticks out, not that your pelvis is significantly and measurably rotated anteriorly. The second big one that gets people all the time is the glute development. Because you have large glutes, for whatever reason, maybe it's soft tissue, maybe it's muscle mass, they stick out more down here, which over the surface of the skin makes it look like you have a big sweeping curve. But when we actually take a moment to look at where the lower back starts, the glutes stick out here, and it's as if this is your lumbar curve. Your lumbar curve doesn't start down here. Your lumbar curve starts at the top when that swooping in from the glutes actually finishes. So you see there's a very small section where you actually, the spine maybe isn't that curved at all, and we can't even tell from the surface. But still, people will make the assumption that because your glutes stick out here, they take that as a measure of the amount of curve in your lower back and say, oh, you've got too much curve. When in actual fact, you've just got glute muscles that are creating the illusion of too much pelvic tilt. In our experience of looking at literally thousands of patients over the years with lower back pain, with accompanying standing spinal imaging, you start to get a real appreciation that the average person with lower back pain who's been told they have anterior pelvic tilt doesn't. They either don't, or actually what's more likely is that they now have posterior pelvic tilt. And we covered this in a full episode of the podcast previously, so I won't go into the details there. but essentially this is the only way you can get an accurate measure of the effect of pelvic tilt, i.e. at the level of the sacrum. You can clearly see the person's hips, you can clearly see the person's spine, you can clearly measure specifically to the degree the angle at the level of the sacrum to see if this pelvic complex is tilted forwards or backwards, and by precisely how much, and whether that measurement is inside or outside normal ranges. And for the vast majority of us with lower back pain, it is within normal ranges. It is not out one way or other. But if it is out, it's more often than not out backwards rather than forwards. So all of those posterior pelvic tucks and pelvic tilts you've been doing and lower ab exercises are actually only making this worse. And this has, as I said, been over thousands of patients, and so many have been told they've had anterior pelvic tilt, and we actually see they have the opposite. The big problem with this is often the people that are advising you on pelvic tilting exercises just don't have the exposure to imaging, and they just don't know. So they have to go on the best thing they can, which unfortunately is bony landmarks. And bony landmarks can be so inaccurate. It's proven time and time again. You have no idea where the spine is when you're touching the skin out here. You have no real idea or accurate idea of where these various bony markers are on the front of the pelvis and on the back of the pelvis when you're touching out here. It's not accurate, it's not reliable, and it's not worth its salt. Ultimately, the position of the pelvis and the lumbar spine are so closely tied, we want to be able to control those effectively. And too many people don't have good control. So here are 3 things that you can do to improve the control of your pelvis, the stabilization of your pelvis, to prevent it tilting in any untoward way and preventing your back pain from getting better. The first thing we want to do is learn to realign our posture correctly. And we can do this using a simple standard measurement of a wall. And we've got a great posture fixing wall drill that you can do in under 60 seconds. There will be a link in the description. You can go and watch that full video. But essentially, we're just lining up our hips over our legs. We're lining up our thoracic spine over our pelvis, and we're lining up our head over our thoracic spine using the wall as a marker. We're then engaging the core without tilting the pelvis in any direction to provide lower abdominal support and general trunk support, and we're engaging those back muscles with a nice chest pop to provide a full support of good posture, which will stabilize your pelvis. Number 2, as you'll so commonly see in many of these exercises, the hips are important. We sit for too long, we have tightness in the hips, hip flexors, in the hamstrings, etc. And having a good routine, a way of easily going through a thorough flexibility routine for the hips that is back friendly is really, really important. And again, we've got a link down in the description for a full live routine. It'll take you just about 10 minutes to follow along with, doing both legs in a way using techniques that are friendly for your lower back, avoiding rounding forward to touch your toes because that's just going to undermine the progress. So check out that link in the description for a full routine that you can follow on a daily basis. It takes no more than 10 minutes, as I said, and it'll really help you keep your hips nice and mobile, which will decrease the strain pulling on your pelvis one way or the other, or both. Finally, the real way that we build a strong pelvic and lumbar region and prevent our pelvis from tilting in one way or other, aggravating our lower back pain, is through building strength and stability. And too many people are confused or misguided around the exercise they should or should not be doing. And that's what we hear from members and what we hear from patients over the years. And that's why we put together the full free 80-minute fixing back pain masterclass. And again, there's a link down there in the description. You can check that out and follow along with the exact exercises that you can do to start to really build some strength in that region of the lower back, pelvis, and further down the body to really deal with your back pain once and for all. Ultimately, over the years, we have seen thousands of patients. We've got a significant volume of information on imaging that really has been so eye-opening, because let's face it, when you go through, whether you're an osteopath studying to become an osteopath, whether you're studying to become a chiropractor or a physical therapist, physiotherapist as they are here in the UK, it doesn't matter. The education around that leads you to understand or expect that your physical examination is infallible, which is probably why a lot of the information online around things like pelvic tilt is, quite frankly, so rubbish, because we just don't have that baseline understanding. And it's only through years of experience that actually being humbled, that actually those examination techniques of a posture that you were taught as gospel at university, they're really not as good as you thought they were. And actually it's only coming to that realization that you don't know what you don't know, or that you don't know what you don't know, that can be really, really transformative in the way in which you start to help people. So knowing that we probably don't know your pelvic alignment. We can know if we want to, but we probably don't know. And therefore focusing on providing stability, because you are a normal human being. You may have back pain that's been there for a long period of time, but focusing on providing stability, strength, and control of the pelvis is infinitely more important than making wild guesses about some sort of pelvic tilt and acting like that's going to fix everything, when realistically, it really won't. And as time has shown us, more often than not, it actually results in you doing exercises that do work to tilt the pelvis the other way, and that results in a real barrier to your recovery, because the overwhelming majority of people with lower back pain, if they have any sort of misalignment, it is a posterior pelvic tuck backwards and a flattening of the lumbar lordosis, significantly in greater numbers than the opposite of an anterior curve, an anterior tilt with too much curve. So just bearing that in mind, hopefully this video has set the record straight with regards to pelvic tilt, and you can move forwards in a more accurate way, building strength in your lower back and recovering from what might be some really bad lower back pain or sciatica. I do hope you found this video helpful. If you know someone else who's been struggling with their back pain, maybe you've seen them doing all those knee hugs, those child's poses, those pelvic tucks, then share this video with them. It'll hopefully be quite insightful and help them better understand their own body and move forwards with more success and less back pain for the long term. As always, thanks for watching, and we'll see you in the next episode of the Back in Shape podcast or the next video on the channel.